talk about panic disorder. So, what's panic disorder? It's an anxiety disorder. And here, the patient has multiple attacks of severe anxiety, multiple attacks of severe anxiety. And why that happens? Oftentimes, there is no specific underlying cause. It just happens. And this is not restricted to any particular situation or circumstance, meaning it can occur at home, at work, when traveling. In any situation, the panic attack can happen. And a panic attack is an attack of severe anxiety where the patient feels the anxiety itself, and the patient feels like he is going to have a heart attack or have a stroke because he or she has the symptoms such as chest pain, severe palpitation, shortness of breath. And the patient oftentimes overventilate or hyperventilate. And that leads to hypocalcemia, and that causes paresthesia. Even in some cases, this can lead to spasm, carpal pedal spasms. And these patients oftentimes seek emergency treatment. We have to exclude the common differentials. So what are the common differentials for a patient with panic disorder or a panic attack? The common disorders are conditions that can lead to hyperventilation, can lead to shortness of breath, such as starting with patients who have hypoglycemia, because those patients are severely anxious, they sweat, and oftentimes they have palpitation, severe palpitation. Cardiac conditions such as arrhythmia. Other endocrine conditions that can also lead to a panic attack-like situation is hyperthyroidism, especially when it's transient, hyperthyroidism, and conditions such as brain conditions such as temporal lobe epilepsy oftentimes can lead to a panic attack-like period of hyperventilation. And some substance abuse such as alcohol abuse and benzodiazepine abuse, when the patient stops taking them, when the patient withdraws, they have overactivation of the sympathetic nervous system, which leads to a panic attack-like manifestation. So whenever we are dealing with a panic attack patient, we have to exclude those conditions by taking history and doing a proper examination. And how to treat the panic attack? The treatment is very simple. The first step would be reassurance of the patient. We have to reassure that you don't have any serious medical illness. So this education, this reassurance is very important. And oftentimes this can be coupled with a CBT or cognitive behavior therapy. Along with the patient will have the relaxation techniques. So reassurance, educating the patient the relaxation techniques, and obviously going for CBD if those doesn't work. We can give drugs in the acute phase. We can give the patient some CNS-acting drugs to sedate the patient or to relieve the anxiety of the patient. So short term, the benzodiazepines would be a very good choice to relieve the patient's anxiety. But the long-term use is generally avoided because this can lead to dependence. The other drugs we can use are the antidepressants in a low dose, such as SSRI, such as TCA, even MAO inhibitors. But among them, SSRI would be the better option because it has a better side effect profile. And if the patient has severe somatic symptoms, such as severe palpitation, tremor, then I think propranolol will be a good choice. And whenever a patient has an acute attack, we have to teach them to rebreathe into a paper bag. That is another aspect of management. Rebreathe into a paper bag. That's another good treatment to terminate an acute attack.